A very good evening all. I'm Aditi Lama with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic. Globally, we are looking at 69.1 million cases of the coronavirus with 1.57 million deaths. In the United States, we have now surpassed 15.5 million cases, and the death toll from COVID-19 in the US is 291,000 and counting. Yesterday, the US reported a sobering number of more than 3,000 COVID-19 deaths, for the first time a single day toll worse than any time in US history. Experts are pleading Americans to scale back Christmas plans and holiday gatherings. The surging infections of coronavirus are overwhelming the hospitals, with many in the West as well as Midwest currently running out of beds, ventilators, and PPE supply. This has prompted stay-at-home orders in parts of the country, with mask mandates in at least 38 states. Meanwhile, the U.S. Food and Drug Administration Advisory Committee has been in a virtual meeting all day today to consider emergency authorization use for Pfizer and BioNTech's COVID-19 vaccine as cases continue to rise, and by the time of telecasting this episode, the FDA may have approved the vaccine. Once approved, the first inoculations could be given this coming Sunday or Monday. Meanwhile, in politics, President-elect Joe Biden's transition team met with Operation Warp Speed, and the president-elect continues to build out his cabinet and present his nominations with the goal to announce all selections before Christmas. He has also placed all his attention on COVID-19 response and has set a goal of vaccinating 100 million people within the first 100 days of his administration. This is happening while President Donald Trump continues to file lawsuits alleging election fraud and is yet to concede to President-elect Biden. And the Congress continues to struggle to end months-long stalemate over economic assistance. So where are we headed with COVID-19 infections surging across the nation, and what rules should we now follow? We present tonight South Asian doctors and Indian nonprofits on COVID-19 updates and relief. Here are the headlines. Dr. Rachana Kulkarni on surging coronavirus cases and vaccine developments, New Jersey. Ekal Vidyalaya Foundation raises record $6.5 million Future of India Virtual Gala 2020. Indian athlete Harikesh Maurya on representing India at Tokyo Summer Olympics. It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome again. I'm Aditi Lama, and this is Vision of Asia, Thursday night episode of South Asian News. Let's begin by taking a look at the coronavirus pandemic's updates and measures. The daily U.S. COVID-19 death toll has surpassed 3,000 for the first time, prompting pleas for Americans to scale back Christmas plans even with vaccines on the cusp of winning regulatory approval. Yesterday, COVID-19 deaths reached 3,253, with a record number of 106,000 people hospitalized with COVID-19 in the nation. Health professionals and support staff across the nation are exhausted by the demands of this pandemic, especially during this winter surge of cases. These healthcare professionals have been watching patients die alone as millions of Americans still refuse to follow advice to wear masks and avoid crowds and smaller gatherings to contain the virus spread. Meanwhile, more than half of U.S. states have recently introduced or resumed restrictions to curtail the rampant spread of COVID-19. In all of this, providing a ray of hope is the vaccine by Pfizer and BioNTech, which is currently being reviewed by the FDA for emergency authorization use. By the time of telecasting this episode, the FDA may have already approved this vaccine. So what do we need to do now, and should we be all vaccinated? Here is health expert Dr. Rachana Kulkarni urging everyone to mask up. This is Dr. Rachana Kulkarni. Today we're looking at globally 69.1 million cases and at least 1.57 million deaths. In the United States, we have reached more than 15.5 million cases with at least 290,000 deaths. My question to you is, how are we supposed to process these numbers, and what are these numbers truly indicating?
It's a very grim milestone, Aditi, in the medical history of United States. And I'll tell you from perspective of a cardiologist that cardiovascular disease is the leading cause of death in the United States for decades. It's the leading cause of deaths and disability for years. And yesterday we hit a grim milestone that now COVID has killed more people in a year than heart disease.
Yeah, for
So
sure.
it's very sobering, and I do believe that a lot of it is coming because two factors. One is the virus is mutating. It has become a lot more contagious. Fortunately, the virus related hospitalization is up here.
Right.
However, fortunately, the deaths are a little lower, as, at least in the New York, New Jersey area, because I think this is our second go around and we know how to treat patients.
Right.
Not so many patients are being hospitalized, but we all, in my opinion, are seeing the after effects of COVID fatigue by people, and also that a lot of people did not pay attention or any heed to the warnings and did see their friends, families, and had get together over Thanksgiving. And I think we are going to see the surge of that between now and I hope people learn from this mistake and don't get together with their families for Christmas. But if we do that, then we are going to see the same surge in January.
Right. The Midwest as well as the West is literally ravaging with COVID-19 as we speak right now. The hospital systems are getting overwhelmed. Why are those two regions, surging with cases at that capacity? What should their governors or their officials do at this point to truly curb this disease?
In my opinion, I do believe that at this point we need to have a mask mandate. People should be wearing masks. It's a contagious virus, but so is flu. But the way you combat that, we don't have a vaccine yet. But the way we combat this is hand washing, covering, wearing a facial covering, and social distancing. And if we do that, a lot of these infections can be prevented. Because keep in mind, once someone gets infected, that person is going to have a ripple effect because it's a highly contagious virus.
It's so true. I hope everybody also follows these ABCs. Let's talk a little bit about therapeutics. I know you mentioned remdesivir. Are there any other therapeutics we should know about right now? Anything new coming in with more research and more understanding?
We do have monoclonal antibodies at this point, although most hospitals have this, and there are strict criteria as to how to use them, but they're available. Steroids are being widely used, and the biggest light at the end of the tunnel is the vaccine, and which is, it looks like it's within our reach now.
Yes, for sure. Now let's actually dig in there and talk about the vaccine because I have so many questions for you. Let's talk about Pfizer and BioNTech's vaccine because that is what's making news this whole week. Right now, while we're speaking, and by the time this show airs, perhaps there might be an FDA approval for Pfizer vaccine. But right now it's approved in the UK and Canada. Can you give me an insight into what is happening in evaluating this vaccine in terms of what are they looking at and what are the mechanisms of this vaccine?
So whenever a vaccine is being developed or any new treatment modality is being developed, you always look for certain criteria. One is how long the vaccine has been studied, in how many patients, and the safety. So you always look at the power of the study. And I have to say, this whole vaccine development within a year has been very impressive. Regardless of what people might think, it's pretty much unheard of how speedily the vaccine got done. And I do believe that a big reason for that was that there was a lot of legwork that was done in kind of anticipation or preparation with that for that kind of vaccine. And all that legwork came to fruition with the mRNA kind of vaccine. So that technology was ready to go, and they applied it very successfully. Both Pfizer and Moderna applied it very successfully to this vaccine production. And that's why it was even possible to get such kind of vaccine in such a short time period.
The Japanese government and the International Olympic Committee, the IOC, have committed to holding the Tokyo Summer Olympics and the Paralympic Games next summer in 2021 with a review of coronavirus countermeasures to be released at the end of this year. The announcement comes after growing uncertainty on whether the Tokyo Olympics would be cancelled altogether, leaving sponsors, tourism and hospitality businesses in a limbo. These postponed games currently face the challenges of balancing athletes and public safety. The opening ceremony is due to take place on July 23, 2021, in line with the ceremonious torch relay. And representing India in long-distance races next year at the Tokyo Summer Olympics will be well-known Indian athlete Harikesh Maurya. Currently training here in the country, Harikesh Maurya is all set to bring a global recognition to his motherland in long-distance races and showcase the strength of Indian athletes at the Tokyo Summer Olympics. A recipient of several awards, here is a segment featuring Harikesh Maurya dedicated to sports and admiration of India on an international level.
माय नेम इज़ हरिकेश मौर्य। मैं गोरखपुर से बिलोंग करता हूँ और मैं जब 13 इयर्स का था तो उस टाइम से मैं निकल गया था घर से और मैंने काफ़ी सारे चैलेंजेस झेले और काफ़ी प्रॉब्लम मुझे हुई। मुझे ये उम्मीद नहीं थी कि मैं अमेरिका तक पहुँच सकता हूँ और इस समय यूनाइटेड स्टेट ऑफ अमेरिका में यहाँ हूँ, आज ट्रेनिंग कर रहा हूँ। ये मेरे लिए बहुत बड़ी चीज़ें है। देखिए एथलेटिक्स क्या है, एथलेटिक्स बहुत ही हार्ड गेम्स है और इसमें बिलीफ सिस्टम जिसके पास होता है वही विन होता है। तो बिलीफ सिस्टम हमारे पास है और जब हम अपने आप को जान लेते हैं, जिस दिन हम अपने आप को जान लिए उस दिन हम विजेता बन गए। क्योंकि सबसे बड़ी चीज़ें यही है कि हम जब अपने आप पे बिलीव नहीं करेंगे तो हम कुछ नहीं कर सकते हैं। तो इसलिए वो बिलीफ सिस्टम ही इतना पावरफुल था कि हमें यहाँ तक लेके आया। सर मैं यूएस में मेरा आने का मेन उद्देश्य यही था कि मैं ओलंपिक खेलूँ, ओलंपिक में मेडल लूँ। और 2017 में मुझे इनवाइट किया गया यूएस से, अमेरिका से मुझे इनवाइट किया गया। यहाँ से सारा वीज़ा करके सब कुछ करके मुझे बुलाया गया, मुझे लेटर भेजा गया, एसोसिएशन ने बोला। उसके बाद मैं 2017 आया और उस टाइम मैं चिकागो में विस्कॉन्सिन में आया और 21 किलोमीटर में मैं सिल्वर मेडल लिया। अब मेरा अभी तक कोई पर्सनल कोच नहीं था, अब मैं खुद ही ट्रेनिंग करता था और खुद ही प्रोग्राम, मुझे अपने में फीलिंग के हिसाब से भागता था कि हमारा बॉडी कहाँ टाइट हो रही है, ये सब कुछ। क्योंकि एथलेटिक्स एक ऐसा डिपार्टमेंट है सर, उसमें हर लोगों को एक डॉक्टर साथ में रहता है, कोचेस रहते हैं, फिजियोथेरापिस्ट होते हैं। तो उससे क्या है, हमारा रिजल्ट अच्छा आता है कि कहीं बॉडी में कुछ प्रॉब्लम तो नहीं है। लेकिन हमारे पास आज तक कुछ नहीं था, ना हमारे पास पर्सनल कोई कोच। क्योंकि कोच बोलते हैं कि नहीं आप ये करिए, हमारा बॉडी कहता है नहीं हम ये करेंगे, तो फिर मैचिंग नहीं हो पाता है और जो हमारा रिजल्ट है अच्छा होने के कारण ख़राब होता है। तो ये बहुत ही इम्पोर्टेंट पार्ट है, कोच का होना और फिजियो का होना और डॉक्टर का होना बहुत ही इम्पोर्टेंट पार्ट है। ये सब हमारे पास नहीं था। तो उसके बावजूद भी मैंने चिकागो का जो रेस था वो मैं एज ग्रुप में सेकंड सिल्वर मेडल लिया। वो हमारा बड़ा अचीवमेंट था। यहाँ पे इंटरनेशनल लेवल में कंपटीशन करना और उसमें काफ़ी लोग पार्टिसिपेट किए थे और आप रिज़ल्ट भी देख सकते हैं। तो उसमें लगभग 7 से 8 हज़ार लोग पार्टिसिपेट किए थे। उसमें मैं सेकंड पोजीशन लिया एज ग्रुप में, बहुत बड़ी हमारी अचीवमेंट थी। फिर मैक्सिको सिटी गया 2017 में। 2017 में भी मैं गोल्ड फर्स्ट किया 10 किलोमीटर में। 2017 में मैं भूटान इंटरनेशनल रेस किया और वो रेस काफ़ी टफ रेस थी। हिल था, एलिवेशन जो था वो काफ़ी हाई था, लगभग 7,800 7,900 एलिवेशन जो होता है वो काफ़ी हार्ड था। लेकिन फिर भी मैंने उसमें भी जाकर के मैंने वर्ल्ड में टॉप 10 रैंक लिया इंटरनेशनल एलिट में। और धीरे धीरे फिर मैं दोबारा इधर मुझे बुलाया गया कि आप रेस के लिए आए और मैं मार्च में इधर फिर अमेरिका में फिर दोबारा आया, अपने खर्चे पे आया। मैंने मतलब काफ़ी घर से जो भी था इस कैरियर के लिए मैंने मेरे पास जो भी था वो सब कुछ मैंने अपने दाव पे लगा दिया। और वो दाव पे इसलिए लगाया क्योंकि मुझे बहुत ही ट्रस्ट है। मैं वर्ल्ड के सारे एथलीट जो हैं उनको मैं अच्छी तरह जानता हूँ। वो केनी साहब अकेले हो गया, मोहम्मद फ़राह ओलंपिक 4 टाइम मेडलिस्ट है और एलिट किपचोगे हैं, यहाँ के जो चैम्पियन हैं, ये गिलेन रूप जो ओलंपिक मेडलिस्ट हैं, 2 आर्मी के और एथलीट हैं, उनको मैं अच्छी तरह जानता हूँ, उनके साथ मैं ट्रेनिंग करता हूँ। तो हमें उनके टाइमिंग से और मेरे टाइमिंग से काफ़ी कॉन्फिडेंस आता है कि नहीं, मैं इंडिया के लिए एक रिकॉर्ड कर सकता हूँ।
Harikesh is a pride of India, what I can say. At this age, at a young age, he started his journey at the age of 13. Now he's been almost like on an international level athletes. I wish we should be very, very helpful to all the young people in India, along with government help. I think we need a help to young people like Harikesh, who can be big stars of India in the world stage. As you mentioned that, yeah, we are proud of India. We've been doing a lot of things good, but now it's time to support athletes like Harikesh. And I'm very much proud that he will win the Olympic whenever he gets a chance. And I wish him all the best. Okay, Harikesh. And yeah, we'll support you as much as we can, and I'm sure you will do that. Thank you.
Namaste everyone. Thank you to ITV Gold for coming here at a short notice and meeting with Mr. Harikesh Maurya. He's an athlete. As you just heard his story, comes from a very humble background, comes from a farmer's family, and we are really glad that he's amongst us, and we are really glad that we are able to promote him, support him in any way we can. So all I'm going to say is good luck. Our support, our best wishes are always with you, and we are hopeful and we are absolutely certain that you will be, representing us in the Olympics, representing India, and you will make us proud. Thank you.
Thank you, ITV, for taking your time and coming over here and to cover. This is a very proud moment for us that we are here with the Harikesh, who is taking part in 2021, the Olympic, who is going to represent India. And we heard his story, and we are here to boost up his spirit and support him. So would like to thank Gandhian Society, Mr. Butala, Mahesh Vaniji, Deepak Vaishya, who came very short notice, all the people to support him. And we would like to wish you all the best on the behalf of the World Vegan Vision, and we want you to become the vegan, become our ambassador, and to promote that. And we'll be behind you all the time. Thank you, and God bless you. Thank you.
It's time for the short break. Stay with us in Vision of Asia, Voice of the Community. We'll be right back. And welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. Let's now take a look at Ekal Vidyalaya Foundation, ITV Gold, Parikh Worldwide Media's long-time media partner. Ekal Vidyalay's vision encompasses a process of empowering rural and tribal communities in India and Nepal based on the concept of social, economic, and gender equality. Focused on eradicating illiteracy in most vulnerable communities, Ekal functions by providing basic education, digital literacy, skill development, health awareness, and much more to empower the communities on grassroots level. On that, recently, Ekal Vidyalaya Foundation USA presented its 2020 virtual gala titled Future of India, during which a record-setting $6.5 million were raised for Ekal's projects and COVID-19 relief efforts. The objective of the virtual gala also was to acknowledge the consistent support of loyal philanthropists and encourage more support for Ekal. Here are some highlights from Future of India virtual gala featuring several renowned personalities such as Indian Minister of Railways, Mr. Piyush Goyal, who applauded Ekal Vidyalaya for all its efforts. Let's take a look.
Some of you may know that Ekal runs a Hari Katha Yojana program where our Kathakars go to villages and impart value education and give good sanskars to our villagers. One such Kathakar, Rupali, had gone to Shiv Sagar jail in Assam and gave a 3-day Katha there. A few years later, when she was traveling to Tinsukia in Assam by train, when she got off the train station, A rickshaw puller pulled up and offered to take her to her destination. Along the way, the rickshaw puller started addressing her by her real name, to which she was very surprised. She said, "How do you know my name?" To which the rickshaw puller said, "Mem Saab, remember a few years back you had come to Shivsagar jail?" She said, "Yes, I do remember that." He said, "Well, I was one of the convicts in that jail and I listened to your 3 day katha. And after I listened to your katha, right there and then I had decided that I'm going to quit all my vices and I'm going to lead a life of honesty. And here I am, a few years later, I'm pulling rickshaws, I'm making very little money, but I'm leading a life of honesty and I'm taking care of my family with whatever little I make." Tears started flowing down the cheeks of Rupali because this was the reward, the real reward that she got when she found out that she had transformed the life of a human being for the better. Such, my friends, is the story of Ekal, is the soft power of Ekal, where we transform the lives of millions of people to live a wonderful and honest life.
The first program of Ekal Abhiyan, which started 30 years ago with the goal of overall development of the tribals, was to increase the literacy of the villages. It later evolved into the Panchmukhi education program. In far-flung areas of India, where no one comes to the aid of the underprivileged society, Ekal schools with one teacher have given birth to many success stories. Today, there are more than 100,000 Ekal Vidyalaya in the nation.
कि 3-4 साल पहले मैंने एक कार्यक्रम में आप सभी से ये आग्रह किया था कि 2022 तक हमें एकल विद्यालयों की संख्या 1 लाख तक पहुंचानी है। लेकिन मेरे लिए खुशी की बात है कि आपने इस लक्ष्य को 3 साल पहले 2019 में ही हासिल कर लिया। मैं एकल विद्यालय अभियान से जुड़े हर सदस्य को बहुत बहुत बधाई देता हूं।
I compliment Ekal Vidyalaya Sangathan for bringing change in the lives of nearly 2.8 million children who come to Ekal schools every day in the over 100,000 schools run in very remote tribal areas. In fact, I see that of late, about 4 or 5 years ago, we had gone to Jharkhand, Ranchi, and there my wife and I met up with some of the volunteers of Ekal, and Seema seeded the idea of sanitary pads being given to the villagers in Jharkhand. Their initial concern was about the environment, but then they zeroed it in on biodegradable sanitary pads, and today I believe across the country we now have a movement where we are providing sanitary pads at only 1 rupee per pad, and for about 100 rupees, which is $1.50, one can ensure that a girl child or a woman would get sanitary pads through the year for just about $1.50. The government is also hugely subsidizing this program. I would urge Ekal Vidyalaya to expand the scope of this program throughout the country, particularly in tribal areas. It's not only about providing the pad, it's about encouraging them to use them. It's about personal hygiene training. It's about the awareness, how important these are, particularly when we are trying to create preventive healthcare for the villages.
Well, this is all for tonight's episode. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.